Good morning. This is Dr. Tariq with some more questions about phlebotomy. Let us start. In an inpatient facility, PPE for the phlebotomist must be provided by the phlebotomist, the employer, the FDA, the OSHA. The answer is B. PPE must be provided by the employer. Following a venipuncture in the antecubital area, the arm should be bandaged for 15 minutes, 5 minutes, 30 minutes, 60 minutes. The answer is B. The side should be bandaged for 15 minutes. Which veins must not be used for venipuncture? Veins on the dorsal side of the hand, veins on the palmar side of the wrist, veins on the dorsal side of the wrist, veins on the forearm. The answer is B. Veins of the palmar side of the hand, of the wrist, veins on the palmar side of the wrist should not be used. The closure cap of a collection tube that contains sodium citrate is gray, lavender, green, light blue. The answer is D. Light blue. Prior to the DTT, the patient should fast for 2 hours, 6 hours, 12 hours, 24 hours. The answer is C. 12 hours. Glutination of red blood cell result from a reaction between red and white blood cell, platelets and coagulation factors, platelets and antigens, antigens and antibodies. The answer is D. This reaction takes place between antigen and antibody. The minimal acceptable draw draw volume for a green capped collection tube is 25%, 50%, 75%, 100%. The answer is B. 50%. The purpose of a blood transfer device is to prevent specimen contamination, needle stick, tube breakage, spillage. The answer is B. Needle stick. If a gray capped collection tube is overfilled, the result may be no effect, low test result, high test results, clotting of the specimen. The answer is D. Clotting of the specimen. For which of the following tests must the blood specimen be maintained at body temperature until processing? Options are cold agglutinin, lactic acid, pH, parathyroid hormones. The answer is A. Cold agglutinin. After collecting a blood specimen in a collection tube that contains adita, the tube should be inverted for 3 to 4 times, 5 times, 8 times, 4 times. The answer is C. It should be inverted 8 times. If a patient in the emergency department refuses to have blood draw, that but the phlebotomist does so at the physician's assistance, the phlebotomist may be charged with assault, negligence, malpractice. The answer is A. Assault. When asked to collect blood from a vascular access device, the phlebotomist should recognize that this procedure is outside his or her scope of practice, requires supervision, requires no additional training, is contraindicated. The answer is A. Is outside his or her scope. When collecting blood specimen with collection tubes with lavender, green and light blue, closure tops of the correct order of draw first to last is green light, light blue, lavender, light blue, green and lavender, lavender, green and light blue, lavender, light blue and green. The answer is B. Light blue, green and lavender. This is all up till now. See you next time with some more questions. I think I have already covered almost all of the phlebotomy. If you practice all my questions, you can be a very good phlebotomist. See you next time with some more questions. Till then, bye.